Well, first of all, we could say that the response is very limited at best. And why? First, I think we have major fear, prejudice, and from fear and prejudice comes enormous amounts of stigma and discrimination from all quarters of society, whether it be health professionals at the local level, whether it be law enforcement agents, families, and other religious leaders, partly because, and fear and ignorance basically comes from a lack of understanding of the issues for transgender people. In this region, very, very few services exist in reality for transgender people, particularly in health settings, but also in employment opportunity, in education, and there tends to be, again, a ghetto effect where transgender people tend to fall into categories of work which are stereotyped, and they also, because of their marginalisation and because as a symptom of stigma and discrimination, they're often forced away from homes, they're forced from meaningful employment, and then they fall into categories of employment which where they have very few choices: sex work, beauty parlours, and again, they're stereotyped. So major challenges. Again, in low resource settings, in many of the countries in our region, health professionals are not trained to understand the needs, the very complex needs, health needs of transgender people. And particularly in the HIV response, they're pretty much invisible in plans, in actions, in discussions around the table. I think getting their confident voice into the larger arena of public discourse is critical, and I think we're seeing a younger, more vibrant and highly professional group of the transgender community who are saying basically enough is enough. We are capable, competent citizens who can, like other citizens, actually go out and contribute very, very effectively to our communities and to our societies. And that's the message I think that came across today. So I think, again, opening spaces, pushing the space, not being afraid to stand up, to find their place at the table in policy discussion, in debates, in framing programming choices, not being afraid to knock on the door of health professionals in the region to make sure that their needs are recognised and that the health system starts to make the changes that need to occur so they get the right services. So I think stepping forward and of course with support and partnership with UNAIDS and a whole range of other organisations, I think this is very possible. Well, I think the conference was an excellent way of bringing health professionals and the community together. I think we should not make any mistake that often the medical profession deal with technical issues, but they don't look at the human face of the community that they're actually working with and supporting. So this has been an opportunity for the community to basically put their issues on the table, their realities, their perspectives on the table, in terms of the way, how they live, the obstacles they face, the challenges they face, and more particularly, how their needs are not being met because we have a very large number of people from the primary to the tertiary health system that really don't understand how to work with and provide primary health to, including HIV services to the transgender, and with the transgender community. So this has been, I think, a very good opportunity for in a global forum, effectively, and with an Asia-Pacific voice of the community to influence the global perspective on how communities need to be engaged and how communities need to be at the centre of owning decisions about their health.